Okay, Miss Amber. So we were, thank you for sharing. I think everyone probably wants to know what happened during your appointments at Impact and kind of what you saw was the difference. I think probably important note for everyone though is to understand that when Amber came to talk to me, I did not shove PT down her throat because PT had been tried and failed at what at that point 3 different times. And
Yep.
so I actually did a study where we looked at low back pain and mobility, and we did a lot on hip mobility. And
Mhm.
so I gave that to Amber to do. And so do you want to kind of tell them about that?
Yes. So I started doing it's a 12 minutes hip mobility flow. And like I've done yoga a ton in the past, but never really emphasized that hip mobility. And so I started doing that and noticed that because the other thing was I was waking up in the morning and really stiff for like half the day. I forgot to mention that. So then they started questioning if I had like the bamboo spine and like RA and stuff like that.
Yeah.
Yeah, so that was when I started going into the doctor because they were wondering like if I was really inflamed or what was going on because I couldn't move until like 2 p.m. Um,
Which
but
is
so
not
then
normal. That
no,
that definitely is not normal. Um,
yeah,
so, I think natural progression would be to look at something systemically, um,
mhm,
but also understanding that all of those domains, when we look at your domains, especially that really heavy psychosocial component, that those the depression and anxiety that's wrapped in that, actually studies show that it's the same chemicals that are in your body are released in your back, and that they can actually congregate in the tissues in your low back area. Um, so I think that's probably a lot of what was going on after we ruled out some of that systemic stuff. So
well, and looking back at that too, I could just see now the progression of it just continually fueling, and it would get stiffer and stiffer, and I'd get more depressed, and
yeah.
um, so then what were we talking about
So
before?
you started doing the mobility program and actually
Oh,
started to feel better.
yeah, so then I started doing that and I started noticing like the morning stiffness was getting better. So then I thought like, okay, we're on to something with this. And then I came into you and then I was like ready to go back to PT. So classic Dr. H, knowing when to just like poke a little bit.
Well,
um,
and you told me about the nerve
ablation, yeah.
ablation, and I was just like, oh,
And it was scheduled. I scheduled it twice and I like chickened out both times and I'm so thankful I did.
yeah,
But so then I went in to see Eric, your husband, and the the biggest thing I remember from the eval is he listened. Like obviously, Impact is so patient focused and just listened to everything in my history of this like 4 years of 3 different PTs. And then the thing I remember him asking is, okay, what have they all tried, and what can we do differently this time? Because in the past a lot of the PTs it's like, well, what's made it feel better, because we do want to know that, but then they would just do the same thing.
yeah, and I mean, obviously, it didn't last. So
Yeah, so
yeah,
he did his detective work on like, what have you tried, what has helped, but what haven't we looked at that could be one of the issues.
yeah.
So
Well,
then he
working on
started.
a team too, right? So I mean, that's part of it.
Right.
Yeah.
So then he looked at like my hip mobility and iliopsoas tightness and did a lot of. And then the other thing with like, I've done that Thunderdome stretch in the past, but for me to feel a stretch with that, I have to prop my thigh up on like a half foam roller and then prop up onto my hands to go into that extension. And so everyone just thought I didn't need it, but
Yeah.
we did that first appointment and the hip achiness was instantly gone.
That's amazing.
It's so amazing. I can't even explain because it'd been like 4 years of
Oh,
that almost constantly.
yeah.
So that's another thing that's been eye-opening for me just as a student, that even though I have that stretch looks different for me and you would think it wouldn't apply to me, it's that is my go-to get out of jail card still today. I make my husband do it for me.
Awesome. It's
So,
awesome.
so
Well,
doing that hip mobility has been, and then once when I do that hip mobility, my low back achiness goes away.
that's great. That's really great. And then, so now that's definitely your get out of jail, or kind of just you feel a little bit tight. And I
Yep.
think too, probably what I foresee happened is there was a lot of positive words used for you, a lot of you can do and you will do. And um, that probably shifted your mindset a little bit from I can't do, and
Yep.
I have to be
Well, and
careful, and I have to.
it gave me freedom to move again too, I think, and not be scared to move because, and especially I think that first appointment, the fact that we made some progress and, got rid of some of that achiness with the stretching, then I felt like, okay, if I do regress a couple steps, then I know I can get back to where I was.
True.
Whereas in the past, I just like kept regressing.
Yeah. Yeah.
So then I was less scared to move. And like you've said, then movement is medicine, and it just kept getting better and better.
Awesome. So kind of tell us what you're doing for workouts now.
So now I'm back to pretty much any CrossFit workout. Like I'm
Got it,
deadlifting it.
girl. Yeah.
I know, it's super nice. And I've done like kettlebell swings, barbell deadlifts. The only thing I'm not doing is Olympic lifting stuff. But that my mindset has switched. Like I remember the first PT I saw, she's like, well, I don't know if you'll ever do CrossFit. And I started crying, and it was like the worst news in the world to me. But now my mindset has switched to like, you have to do what's best for your body, and you can still find things to customize that still give you that same feeling and are better for you in the long run. So that's really the only thing I'm not doing, but I don't really care anymore.
Yeah. I mean, I think there's probably a time and a place for things, and it's a good empowerment lesson. And it's not that you probably can't do it. It's just, you found joy in other ways, and
Yeah.
maybe don't
And
need
I'm
that.
back to squatting and lifting weights and doing pretty much anything. But now another thing that I know I have to do is really warm up well with like the super band stretches, the hip cars, and then doing like my thoracic mobility stuff. And then doing like some core stave activation before I get into my workout. And then I can pretty much do anything.
Good. So, I mean, what I hear you say is like you're actually just priming. You're doing
Mm-hmm.
a lot of priming of your neural system,
Yep.
so that you're just ready, right?
Yep.
For movements that, um, maybe potentially could have hurt you. And we don't know, right? I mean, you were doing such a consistent routine of CrossFit at that point that you might have had an injury, and your body went through this kind of normal progression of trying to heal itself, but then it just became really pretty debilitating. So,
Yeah. Well,
uh,
and you taught me too with you just have to find a balance.
yeah.
So you have your CrossFit workouts, but then doing yoga like middle of the week, I remember you said in the end of the week, and then that gives you kind of the freedom to then add in those tough workouts, do your yoga, tough
Yep.
workouts. And then that's been huge for me too.
It's good. And I think too, probably a good lesson for all of us is your belief going into PT that last time was you had reservations, but you had a lot higher level of belief in Eric,
Mm,
really, and impact, because you had been exposed to our belief system through your schooling and things like that. And then you had some success on your own too. I think that's um,
yeah.
and then I would say probably Eric's confidence in
Hmm.
general probably carried forward to you, that you didn't have to worry about that.
Yeah. Well, and just I think I've talked with a few of the students about this too, on the the way it feels to have someone 100% on your team to get you better. Like even if you don't, as a student, don't know the answers, if you're there and with them to be by their side, to be their person in their
Absolutely.
recovery, it's just so empowering.
Yeah,
And like if you don't know the answer, you can find out the answer, but you can start being on their team right away. So that's
absolutely.
another thing Eric does great, like so optimistic and energetic. And that was just,
Yeah.
it felt great.
Good. Good. Any other words of wisdom for these guys, or?
Oh dear, I don't know. I
Well,
don't think so. I think that's a big thing though. Like you're not going to feel like you know the answers right away, but you can be that person to, because back pain's tough. It's like we talked about, it's so psychosocial and probably more so than a lot of other issues since a lot of it's chronic, but you can be their cheerleader right away from the beginning. So that can be helpful.
absolutely. Absolutely. Good. Well, thank you. You're amazing, and just so lucky that we have you in our circle, and just excited for your next steps. So, and
Thank you.
yeah. All right. I'm going to hit stop, I think.